How can I understand confusing cancer medical terms? When someone you love gets a cancer diagnosis, the medical words can feel like a different language. It's normal to feel overwhelmed by all the unfamiliar terms. But understanding these words can help you feel more confident and support your loved one better. Let's start with the basics. Cancer is a group of more than 100 diseases that involve cells growing out of control. Normally, cells grow, divide, and die in a controlled way. Cancer cells ignore these rules and keep dividing, which can form a lump called a tumor. Not all tumors are cancer. Tumors can be benign, meaning not harmful, or malignant, which means they are cancerous and can spread. When doctors talk about how cancer has spread, they use specific words. If the cancer is only in the original spot, it's called localized. If it has grown into nearby tissues or organs, it's invasive. When cancer spreads to other parts of the body, it's called metastasis. For example, if breast cancer spreads to the lungs, it's still breast cancer but in a new place. Blood cancers like leukemia or lymphomas are considered stage 4 because the cancer cells travel through the blood or lymph system. Staging helps doctors understand how advanced the cancer is. They use a system called TNM. T stands for tumor size and whether it has grown into nearby tissues. N is for whether the cancer has spread to lymph nodes. M means metastasis or spread to distant parts of the body. The stage is numbered from 0 to 4, with 4 being the most advanced. After treatment, doctors often do restaging to see how well the treatment worked. Treatment terms are also important. Chemotherapy uses strong medicines to kill cancer cells or stop them from growing. It can be given as a pill, injection, or infusion through a central line, which is a tube placed into a vein. Hormone therapy blocks or removes hormones that certain cancers need to grow, like breast or prostate cancer. Cytotoxic means something that kills cells, which is what chemotherapy does. Understanding how cancer behaves is helpful too. Acute means it comes on quickly and lasts a short time. Chronic means it lasts for a year or more. Atypical describes cells or tissues that look unusual under a microscope. Recurrence is when cancer comes back after treatment. Refractory means the cancer does not respond to treatment. Secondary cancer is a new cancer that appears after the first one. Doctors use many tools to diagnose and monitor cancer. A biopsy takes a small sample of tissue to look at under a microscope. Tumor markers are substances in the blood or tissues that can indicate cancer. Imaging tests like a CAT scan or computed tomography scan create detailed pictures of the inside of the body. A central line is a tube inserted into a vein to give medicines or draw blood easily. There are different types of cancer. Carcinoma starts in the lining of organs or skin. Melanoma begins in skin cells that produce pigment. Genes also play a role. Proto-oncogenes encourage cell growth normally. Tumor suppressor genes slow down cell growth. When these genes mutate, they can cause cancer. Oncogenes are mutated genes that cause cells to grow abnormally. If you're caring for someone with cancer, ask questions. Write down words your loved one's doctor uses. Don't hesitate to ask for simple explanations or repeat information. Keep a notebook or use your phone to record key terms and their meanings. Many cancer centers provide written materials or websites with glossaries. Attending appointments with your loved one helps you hear the words in context. Remember, you don't need a medical degree to understand these terms. Learning this language is a way to support your loved one and be part of their care team.